How's everyone doing?
Very good.
That's great. Okay, so let me introduce myself. I'm Dr.Sumbal, your MRCOG-1 mentor here with Instutors. So I would like to welcome everyone. I hope you will find this session very helpful. So the topic for today's session is basically on mastering the anatomy identification Sba'S for MRCG Part 1 exam. And meanwhile, I will tell you what are the key strategies and what are the practice tips which would help you to ultimately solve those such kind of SBA. And one thing I want to tell you, this session is all about, we arranged this session because of many students has requested on this topic because they were really struggling with the anatomy and they found such SPs very difficult whenever they will give you a picture and ask you to identify the particular structure. Okay, before we start today, please to let me know in the chat box how many of you are writing January 2025 exam and how many of you are willing to sit in July 2025 exam. Okay, so majority of you are going to write January 2025 exam. Best of luck. Okay, don't worry about that. We will discuss why you are not able to take the decision. And I understand there must be very challenges. You are managing so many things. So that's why you are confused and you are not able to take the decision. Okay, so let's begin. Okay, let me tell you what would be the format of today's session. I have added some SVAs, which are basically from the recalls. So what I'm gonna do, I will show you the first question slide, and then you will have 45 seconds to answer the question. And once I show the slide, your time would be started at that very time, and you need to drop your answers in the chat box. And right after 45 seconds, I will show you the answer slide, and then we will discuss together why that particular answer is the right answer and what are the other things we need to keep in our mind if it comes to solve the SBAs in which they have given a picture, especially for the anatomy and how you can easily identify different structures. And not only I'm going to focusing on the picture or the diagram type SBAs, meanwhile, I will tell you what are the other relevant questions from that particular topic. So let's begin. There you go with your question number 1. Okay, let me read the question for you. Regarding the following picture of brachial plexus, what is the D structure represent?
Should we write answers in the chat box?
Yeah. Okay, your time's up. Yes, B is the right answer. Very well done. Okay, some of the students to goes with the option D, and some of the students go with the option E. So let me break down this SBA. Okay, let's understand what is the role of brachial plexus in MRCG-1 curriculum, why they have added this topic. The reason behind is that how it is relevant to the obs and gynae curriculum. Basically, what happens during spontaneous vaginal delivery, there is a term, we call that term as shoulder dystocia. So what happens during shoulder dystocia? The shoulders of the baby got stuck in the birth canal, and due to if we want to pull that if we want to pull out the baby, and if we apply too much pressure, if we pull very hard, what happens? The the most important complication happened after the shoulder dystocia is the brachial plexus injury. So that's why they have added, they want you to understand the very basics of brachial plexus. However, in one of the previous sessions, I have shown you the MRCG-1 curriculum, and in that session, I have shown you what are the topics of anatomy you need to cover for MRCG-1 exam. So brachial plexus, yes, it is the part of upper limb, but it is relevant for the obs and gynae because due to the complication of this shoulder dystocia. So now let's break down this. Why B is the right answer, how we know that it is median nerve. So anyone have any explanation, you are more than welcome to share that. It would help to create a friendly study environment. Those who answered correctly, that is B, median nerve. How did you get that it is median nerve? How did you identify?
Because median nerve has C6, 7, and 8 nerve innervations. So I knew that and I read that. That is why I have identified that it is median nerves.
Excellent, Dr. Humera. That's excellent. Let me show you what is brachial plexus. Basically, we have pairs of spinal nerves, and those spinal nerves create different types of plexus in our body. So brachial plexus is one of those plexus. It is a network of nerve fibers that supplies the skin and the musculature of the upper limb. It begins in the root of the neck, passes through the axilla, and runs through the entire upper extremity. The plexus is formed by the root value of the brachial plexus is C5, C6, C7, C8, and the first thoracic spinal nerve, which is T1. And this is a simplified diagram of the brachial plexus. And now you can see here the median nerve. According to Dr. Humera, that was excellent explanation. It is formed by the union of lateral and the medial cord. And then if you trace back the root value, it has the root value from C5, C6, because ultimately C5, C6 forms the lateral end, and then it also receiving the fibers from the C7, then C8 and T1. However, in some of the humans, the C5 fibers may be not there, but ultimately the median nerve, the root value is C5 to T1. Okay, there you go with your second question. And your time starts now. Let me read the question. A 26-year-old female presents to the gynecology clinic with complaints of discomfort and pain during sexual intercourse for the past few months. She also reports occasional itching and swelling in the vulvar region, especially near the vaginal opening. Upon further questioning, she mentions the pain intensifies with pressure applied to the lower parts of the vaginal vestibule. So, given the diagram, identify the following structure. Okay, I think we have got enough answers. Let's move on to the answer slide. Yes, A is the right answer. Excellent to those who answered correctly, and keep it up for those who go with the wrong answer. So here you can see the labeling. This is the vaginal. This is a picture of the vulva, in which you can see different constituents of the vulva of the female genital tract. So what are the structures? Here you can see on the topmost area, it is the clitoris, which also takes participate in the formation of vulva. Then we have on the top around the urethra, we have Skinny's gland. Then we have urethral opening, then introitus, and here you can see at 4 and 8 o'clock position the Bartholin glands. And don't confuse, Bartholin glands are also known as greater vestibular glands. And whereas the Skinny's gland, they are known as lesser vestibular glands. So whenever in the exam, if they twist around the information, if you don't find the option of Bartholin gland, don't confuse. The Bartholin glands and the vestibular glands are the same thing, and more specifically, Bartholin glands are the greater vestibular gland. Whereas the uh, Skinny's gland are also known as lesser vestibular glands. So let's have a look on vulva anatomy. And there is an SBA in the recalls from the vulva anatomy, and that's the reason I have made the slide. There is an SBA in the recalls in which they have given some options and asked you which of the following is not the component of vulva. So there could be many variants. Either they might give you all the options, and in the option E, you will find the option of all of the above. Or maybe they will give four incorrect options and one correct option, or they may maybe give all the correct answers and one incorrect answer. So in that case, you need to be very clear what are the components of the vulva. So what is vulva? Basically, it is a global term that describes all the structures that make the female external genitalia. So what are the structures in the female external genitalia? What are the components? That is mons pubis, labia majora, labia minora, clitoris, vestibular glands, vulva vestibule, Bartholin glands, Skinny's gland, urethra, and vaginal opening. So these are the components, and you need to remember each one of them so that if any type of SPA, if they twist around any SPA, you know the components and you can easily solve this SPA. And trust me, these are the easy marks. So let's talk a bit detail about Bartholin gland. It is also known as, again, greater vestibular gland. They are pair 0.5 centimeter glands located in the lower right left portion at 4 o'clock and 8 o'clock position of the vaginal introitus. The Bartholin gland is a mucus secreting gland which plays a role in vaginal lubrication. Bartholin glands are generally non-palpable when not obstructed. So again, here you can see this is the anatomy of the vulva. We have mons pubis, clitoris, urethral opening, labia minora, labia majora, vaginal opening, and then below that there is perineum and anus. So any idea? Okay, in the slide I have shown the function of Bartholin gland. Anyone have any idea what is the function of Skinny's gland? Any volunteer who knows the answer? What is the function of Skinny's gland? Okay, let me tell you. Basically, the function of the Skinny's gland is solely to provide lubrication for the vagina. So why I have named this gland? Because anytime, if you do your study in a comparative way, you will never forget. So now you will have an idea what are Bartholin glands, where they are located, and what are Skinny's gland and where they are located. So moving Onwards to our next question. A diagram of the fetal skull is provided during an OBS practical exam. The area labeled B is located on the superior lateral side of the skull. Which of the following bone corresponds to the area labeled as B? Your time starts now. Excellent. B is the right answer. Let me break down fetal skull. The fetal skull, the major bones that compose the skull of a newborn include two frontal bones, two parietal bones, and one occipital bone. Here you can see, this is something we have been studying from our medical school. So here you can see the frontal bone, parietal bone, and the occipital bone. So how many bones are there? Two frontal bone, two parietal, and one occipital bone. Then, then in the exam, either they might ask you the question for the identification of fetal skull bones, or they might ask you questions from the sutures. Sometimes it happens. For instance, in this case, they are asking about the B labeling, but they might ask you about the labeling of the A options. So any idea what is the structure which is labeled with option A?
Sagittal suture.
Yes, that's excellent. Okay, so let me break down. We have three sutures. One is the coronal suture. Here you can see this is the coronal suture and how it is formed. Because sometimes what happens, they might give you a picture and sometimes they do not give any picture. They just mention, tell us what is this suture which is formed by each frontal bone plate meets the parietal bone plate. So what suture is formed between frontal and the parietal bone plate? So the answer would be coronal suture. So you need to remember each and every aspect. Then when it comes to the sagittal suture, it extends from the head to the back, down the middle of the top of the head, and the two parietal bone plates meets at the sagittal suture. Here you can see, so in the exam, if they haven't given any picture and they just mention what is the suture is formed between two parietal bones, then in that case, the answer would be sagittal suture. And when, if they have mentioned or if they are labeled, the structure that extends back of the head, each parietal bone plate meets the occipital bone plate at the lambdoid suture. So ultimately, the lambdoid suture is formed by the union of parietal bone and the occipital bone. So these are the key points you need to remember. And you might get any type of question from the fetal skull. Again, either they might ask you the fetal skull bones or the sutures or the fontanelles. So what are fontanelle? In the fetal skull, we have two fontanelle, one interior and one posterior. So what are fontanelles? They are space between the bones of an infant skull where the sutures intersect, that are covered by tough membrane that protect the underlying soft tissue and brain. So it includes interior and posterior fontanelle. So how does the anterior fontanelle form? It is a junction where the two frontal and two parietal bones meet. So again, in the exam, if they twist around the information, if they haven't given any picture and asked you about the labeling, but rather they have mentioned what is the structure which is formed by the union of two frontal and two parietal bones, that means the answer would be anterior fontanelle. Then the posterior fontanelle is the junction of two parietal bone and occipital bone. So make yourself clear, if they have mentioned the union of parietal bone with frontal, that means anterior. And if they have mentioned the union of parietal bone with the occipital bone, and this is something very easy to remember, that is posterior fontanelle. Am I clear, everyone?
Yes, perfect. Thank you.
Okay, no worries. Okay, one thing suddenly came to my mind. Yesterday, what happened? A student reached out to me, and what was she telling me? She had enrolled in a low price exam course, but now she was struggling with the basic concepts, and she was very worried because she feels like she has wasted both her time and money. So, upon her request, I took her into our course. But I want to make something very clear here. Please don't rush into low priced courses without checking their credibility. I'm not asking you to join our course, or I'm not recommending any else course. I just want to make sure any course you are going to enroll yourself, please make sure to check their credibility, the quality of their content, and how they are teaching you. Because ultimately, you will not only suffer financially, but also by losing your valuable time. And what happened? Yes, I took her into my course, but honestly, it becomes very difficult for me to start teaching from the scratch and correct all the misconceptions, which then creates confusion even with the very basic, simple SPA. So I hope I have made this point clear. So make sure when and how and in whom you need to invest your time and money, because your time is very precious. And one more thing, I won't take much of your time. Uh, yes, we offer a friendly study environment, but we also maintain professionalism. And in this session, we will take the feedback from our current MRCOG-1 premium course students, so that you have an idea. And always the time of my students is extremely valuable to me, so I strive to give them the best possible learning experience. However, there are many who focus solely on creating a casual atmosphere, taking unnecessary breaks during teaching sessions. I understand a comfortable environment is important for studying, but we all are doctors here with busy schedules, and we barely manage to find time to study. So my advice is to use your study time wisely and to the fullest. So this is a tip I want to share, being your mentor. So always be wise with your time and your money. So let's move on to our next question. In this diagram of the posterior pelvic region, which muscle is labeled as B? Okay, your time's up. Yes, B is the right answer, piriformis muscle. I want to highlight this. It is worth mentioning that piriformis muscle is very important. There are many questions which comes from this topic. Do you have anyone have any idea why piriformis muscle is important and why it holds a significance in MRCG1 curriculum? Any idea? Why it is a key muscle in the gluteal region?
Muscles are very difficult to remember. At least for me, I find it very difficult.
I understand. but there is always a trick and a strategy. If you know that strategy, you can ace any question.
Please help.
Yeah, definitely. Okay, one thing I want to clear again. In the MRCOG-1 exam, this exam is all about the SMART approach. The basic subjects, they're very, very, very extensive. However, the MRCOG-1 made our task very easier by focusing only the topics which is relevant for the obs and gynae clinical practice. Like when it comes to the anatomy, we only focus on the anatomy of abdomen, pelvis, and perineum. That's it. But still, in abdomen, pelvis, and perineum, there are so many things. There are so many details, and it is not possible for anyone to remember each and every muscle attachment, origin, and function, and everything. So one thing, try to be focused, have smart approach, try to focus on things which are repeatedly asked in the previous exams. That's why I have particularly added this slide regarding piriformis muscle, because this is the muscle out of which there are many SBAs in the recalls. One SBA is from the identification of piriformis muscle. One question is regarding its origin insertion. So I have added the attachments here, and this is your another SBA from the recalls. So from this slide, you will cover your two SBAs. One is the identification and the other one is the identification. So what was that SBA? As far as I remember, they have given the sequence of attachment and asked you to arrange that in the correct manner. So what is the attachment of the piriformis muscle? It originates, please listen carefully. Piriformis muscle originates from the interior surface of the sacrum. The fibers travel inferiorly laterally through the greater sciatic foramen and insert into greater trochanter of femur. Now you need to remember three keywords in the sequence. Whenever you get any SBA from the attachments of the piriformis muscle, one thing you need, if you want to arrange in the order, first thing is interior surface of sacrum. Don't confuse, it is not posterior, it is not lateral, it is not medial. It is anterior surface of sacrum. The second keyword is the greater sciatic foramen, and the third keyword is the greater trochanter of femur. Now you can see here, it is originating from the interior surface of the sacrum, then passing through the greater sciatic foramen and inserting into the greater trochanter of femur. Now my very first question regarding piriformis muscle, why it holds so much significance in the muscles of the gluteal region, and why the RCOG has put this in the curriculum. So the answer is because this is the key muscle which helps to rule out the structures or contents of greater sciatic foramen and the lesser sciatic foramen. So for your ease, I know this topic is a bit complicated. I want to teach you regarding greater and the lesser sciatic foramen. Okay, so here you can see the greater sciatic foramen is divided into two parts by the presence of piriformis muscle, which itself shows the extent of the attachments of piriformis muscle. So in the previous slide, we have discussed about three keywords. One was interior surface of sacrum, then greater sciatic foramen. And now you can see how the piriformis muscle is passing through the greater sciatic foramen. And its significance here is that it divides the greater sciatic foramen into two halves. The space above the piriformis muscle is known as suprapiriform foramen, and below the piriformis, it is infrapiriform foramen. So what are the contents which are above piriformis muscle? Don't worry if you don't understand this right now. In the next slide, I will show you the diagram, then you can better retain the information, the contents of foramens. So now let me show you the diagram. Here you can see this is our piriformis muscle, and it is passing through the greater sciatic foramen. And now you can see the spaces, the foramens are very visible. This is suprapiriform foramen, and this is infrapiriform foramen. And the name is very simple. The supra means above piriformis, and infra means below piriform muscle. Now let's look at the contents which are passing through here. So the contents of suprapiriform foramen is superior gluteal artery and vein and superior gluteal nerve, easy. Then inferior is the inferior gluteal artery and vein and inferior gluteal nerve. sciatic nerve is a very important component. It is please remember, you might see here, this is a picture. You can see how the sciatic nerve is going to pass through the greater sciatic foramen, and now it is very visualized that it is passing in through the infrapiriform foramen. It is below the piriformis muscle. So this is a sciatic nerve. So if in the exam you will find a picture in which they don't ask you about the piriformis muscle, rather they have labeled the sciatic nerve. Now you should have an idea. This is the thickest nerve, longest nerve of the body. And now you can see how it is passing through the infrapiriform foramen and entering into the thigh. So this is your sciatic nerve. So coming back to this diagram, then we have posterior femoral cutaneous nerve of thigh, internal pudendal artery and vein, and pudendal nerve. So these are very, very important, again, very important structures. And there are many, when it comes to the SBAs from the anatomy of pelvis and perineum, the RCG love to ask about the anatomy of internal pudendal artery and the pudendal nerve. So this is the significance of piriformis muscle, and this is the significance of the contents of greater and lesser sciatic foramen. Okay, then let's have a look on lesser sciatic foramen. This is, okay, above is your greater sciatic foramen and below is your lesser sciatic foramen. So now let's have a look on the contents of lesser sciatic foramen is the internal pudendal artery and vein, pudendal nerve, and tendon of obturator internis muscle. Okay, there are many SBs from this topic. If
Hi,
you,
Dr. Sumbal.
yes,
Dr. Sadia wants to say, answer some queries.
yeah, go ahead. I will come back to this topic once Dr. Sadia is done talking.
Okay. Hello, everybody. This is Dr. Sadia Iman from Instutors. How are you all doing? You can write in the chat box or you can unmute your microphone. I would really appreciate your responses.
We are fine, Dr. Sadia. How are you? Thank you very
I'm
much for
doing
arranging such an informative session for us.
Hi, Shah. Okay, so I was wondering if how many of you have achieved your first milestone, which is your eligibility? How many of you already have received your eligibility approval?
Me?
Okay, Dr. Humera has got the eligibility approved. Dr. Sakina has also got it.
Me too, I guess.
Okay, so Dr. Farina has also got it. Okay, so there were a lot of queries, as Dr. Sumbal shared in the beginning, that a lot of people came to us and asked about the preparation, like how to prepare for this exam, because, you know, we are doctors and our life is really hectic. Like lifestyle is like quite hectic, so we can't manage to balance with our life and studies. So let me tell you something about which is like really important for you. So for that we have Dr. Mehek and Dr. Minhal to keep a track on you, because we also need to keep a track on our preparation. So we must have someone beside who can do that for us. So let me share the screen so you can see how we actually do that. Okay. And do let me know if you could see my screen. Is it visible? Can you all see it?
Yeah, we can.
Okay. So first of all, we have 15 live sessions. Because, you know, this is MRCOG-1, this is basic sciences, and we don't need to go into depth. So what we do, we go for the live sessions, which is like with the schedules. In this, you will have comprehensive coverage of all subjects. Then you will also be given the mini schedules. So we have, as I told you, that we have 515 interactive exam-oriented live sessions. After that, if you listen to those lectures, you won't have to open any book. And we will give you mini schedules that covers your daily tasks, including your high-yield topics of each subject. Okay? And in case you missed the live session, you will also be given the session recording. As I told you, you won't have to open the book. You can mark my words. Believe you me, if you just listen to the lecture, you won't have to open the book, because as I told you, we don't have enough time to open the book. We don't have enough time to confirm things from here and there. Just you need one platform that gives you authentic and comprehensive material. And in this intensive discussions, in this, as I told you, that Dr. Minha and Dr. Mehek, they will keep a track on this. After that, you are also going to have the question pool updated. Like, we prepare students subject-wise. For instance, you start with anatomy. You're going to have a live lecture on anatomy first. You will be covering the high-yield topics of anatomy. This is for your foundation. This is for your concepts. Once you are done clearing your concept through your live lectures, you are going to jump on the SBA practice on the Telegram group, as I told you. This will be the SBs of that one specific subject, which is anatomy. And then after that, you are going to go for the subject-wise recalls. We have extracted subject-wise recalls for you, so you can prepare each subject perfectly. Okay, and also we had made an update for the January students that you will also have these subject-wise recalls in the PDF forms and also in the quiz form, in the question pool form. So you can prepare yourself for the real exam. Okay, and the most important thing, then we have made 13 recall papers in the form of quiz from 2019 to 2024. So you will have it solved, and also you can like easily tell you everything. Okay, as it I lost the track. Subject-wise recalls are done, then year-wise recalls are done 2015 to July 2024, and these are solved recalls. You won't have to, as I said, that you won't have to confirm things from here and there. What's the right answer? What's the explanation for this? You will get each and everything in this platform. And then for your revision, flashcards will also be there, and your mentors will be there on all the steps with you. And after that, you enroll in the special 10 days recall workshop. You can practice each question for with a mentor, so there will be no chance left to fail this exam, because this exam is more strategic. It's not like that you have to study each and everything that you had studied in your MBBS. No, we are going to go over for only higher topics. We are not going into detail. We are just studying smartly. Understood? Am I making sense to everybody? If you have any question, they may write in the chat box so I can explain. Most importantly, that we will also give you the mini schedule. In mini schedules, you will be given the subject, the higher topics, like your daily task, what to do this day and what to do next. How are you going to prepare yourself for this exam? Mini schedules are like those, and you will get the mini schedule of each subject. Okay, so you can see this is the picture of our previous batch, and these are the happy faces of our previous batch. We also have our current batch here. May I please call Dr. Sakina? If you could share your valuable feedback with us, like your experience with Med Instutors, its course material, the IT team. What do you think about us? Please share your thoughts with everybody.
Hey everyone, am I audible?
Yes, you are.
First of all, I'm very thankful to Med Institute team for their lot of support, especially 24/7 support. Their course is very impressive. Alhamdulillah, mentors, they are available just on a call and text away, 24/7 support. And secondly, their mock exams are very good. It's my personal experience that I just gave one read to endo mock and I score 87% marks in mock with just one read and one lecture.
Thank you so much, Dr. Sakina. We also have Dr.
Yeah.
Momna here. Dr. Momna is also one of our premium students. She would like to share her thoughts. Dr. Momna, are you there? Do we have Dr. Zanera? Do we have any other premium students with us? Okay, that's fine. Okay, most importantly, what I want to share with you all that I'm Dr. Sadia. I will be there for you if you need any kind of help. It's not only about the studies. Sometimes we get overwhelmed with other things, with our life matters, you know. So I'm here. You can rant about anything with me. I'm just a one call or message away. You can call me, you can text me about the material. If you need any emotional support, if you need any IT support, if you need any kind of help, I'm available. It's not like that I'm just saying it, I mean it. If I say it, I mean it. Yes, Dr. AE, we need a schedule with topics, and I think this will give us a general look so we can take a decision to join January July. Yes, definitely we will share that. And most importantly, we are not going to waste our time. We are not going to waste our money because, you know, exam is quite expensive. We are not going to waste that because time is the luxury. We can earn the money, but we cannot earn the time. We have, if you spend a lot of time on study, but you are not able to make, make it at the end. So this is not what we want. Our major purpose is to help you ace the exam. Are you getting my point? Regarding the books and study resources. So first of all, the books that we recommend are Oxford Revision, Exam Essentials, Catherine, and also Pasa Masuji. But do not rely on these books only because these books are quite old and RCOG, they update their guidelines quite frequently. So you need to stay updated with updated guidelines. So Dr. Sumbal, she prepares, all of our mentors prepare the lectures according to the new guidelines so you can stay updated and prepare the updated material. We cannot rely on the books only. You need additional resources like Q banks, as I told you earlier. You need Q banks, you need recalls. Recalls are the most important part. And you know, I have something better for you. The July candidates and also the students who are appearing in January but do not have, they haven't started their preparation yet. So this is what we are offering. Our batch 3, we already have 2 batches going on. Batch 1, which started in June, and batch 2, which started in August. And we are going to start our next batch 3 in September 20th. So you can join that. This is how you are going to get the organized schedule. You are going to get the mini schedule of all subjects. And this is not only for January students, but also for July candidates who are preparing for next attempt, but for some reasons they couldn't submit their eligibility, and they want to start their preparation now, because it's good to start earlier so they can have enough time for the revision later. Because we are doctors, we cannot we don't know what happens the next moment, so we should be prepared in advance. Interactive live sessions will be there for all subjects. Recordings will be also available, and you will also be given the notes of all subjects. And every day there will be discussion on Telegram with mentors. Subject-wise recalls will be given, they would be solved. Year-wise recalls will be given, all books and essential material will be provided, okay? And subject-wise marks are important. First, this is for the long course that you are going to get the live lecture. After that, you will practice the Sba'S with mentor. You will going to practice the recalls of subject-wise recalls of that subject that which you are preparing. And after that, once you are done with your subject-wise recall practice, you are going to take the mock of that subject. This is how we are going to do. This is how we are going to do for all of the 14 subjects. After you are done with your subject-wise prep, you are going to jump on your year-wise. After doing the year-wise recall practice, you are going to take the RCOG person pattern mock exam. It's like a real exam, which is going to give you the same anxiety, same thrill. So this is how you are going to prepare yourself. When you are going to take the Pearson pattern mock exam, these are the big mocks. You're going to take them and you will realize where do you stand in terms of your preparation. Are you getting my point? Okay, so this is for all of you, and we also have currently we are having another great offer, which is 3-in-1 course. We are giving you 3 courses in just one price. Our premium long course, which costs $300, and our Power Hour course, which is short course, it costs $250, and our recall workshop of 10 days, it costs $100. Altogether, it's $650, but we are giving you all of these 3 things in just $300. So if you would like to join us, so you can just drop me a message and I will be there for you. And it's not only about the course material, I will be there for you for anything, even if it's emotional support, even if it's for any kind of support that you need, I will be there. So thank you so much for listening to me. And thank you so much, Dr. Sumbal, for giving this chance to me to speak to the students and share what's the best for them.
Thank you so much, Dr. Sadia, for giving us your time.
You're welcome, and you may carry on, please. Thank you.
Okay, coming back to our lecture, we were talking about the contents of greater and lesser Sciatic foramen. And I was reading a question. I don't remember the name of that student, but the question was, why the internal pudendal artery, pudendal nerve, they are in the list of the contents of lesser Sciatic foramen, as well as they are in the list of the contents of greater Sciatic foramen, and that is a brilliant question. Why this is a brilliant question, and that was the point I want to highlight. That in one of the recall, there was a question in which they asked about what are the exact contents of the lesser Sciatic foramen which leave the pelvis cavity. So the answer to this question was, what happens if you can see the internal pudendal artery and vein, and if you can see the pudendal nerve? Do you think that these nerves and arteries would go to the lower limb? Because ultimately, the structures which are passing through the greater or lesser sciatic foramen, they are using this gateway to enter into the lower limb. So do you really think that these arteries and nerves are needed in the innervation or blood supply of the lower limb? Any idea? Use your common sense. Try to recall your previous information, your previous knowledge when you were in the high school, when you were studying anatomy.
I
So
don't
what
think so about this pudendal nerve. It doesn't go.
Yes, because pudendal nerve is the major nerve which innervates the perineum. So when you start studying perineum, you will see each and every structure, they are innervated by the pudendal nerve. So it is the key nerve in the perineum. So that's why what happens, yes, it comes out through the greater sciatic foramen, but it after passing through the lesser sciatic foramen, it re-enters into the perineum. So in a true manner, it actually does, even after passing through the lesser sciatic foramen, internal pudendal artery and vein and pudendal nerve, they not completely leave the pelvis and the perineum. They enter back into the cavity and supplies the area where they needed, either they will have some innervation in the pelvic region and it solely have the innervation and the blood supply to the perineal organs. So that's why if you find a question, this is a recall that what is the content of the lesser sciatic foramen which leaves the pelvic cavity? So the answer would not be internal pudendal nerve, internal pudendal artery. You need to exclude this because it re-enters into the perineum or pelvic cavity. Vein would be absolutely incorrect answer. Pudendal nerve, no, because it doesn't leave the pelvis. It comes back and supply the area of the organs of the perineum. Yes, but the tendon of obturator internus muscle, this is something which actually leaves the lesser sciatic foramen. So this would be your single best answer. Am I clear about this point? If you understand things logically, then there is no need to memorize the course and the contents and everything of the anatomy, because anatomy is very extensive. It is really volatile. So try to understand things logically, try to interconnect everything, and try to use your common sense. So in this particular way, if you discuss every SBA, if you discussed high yield points, you will never ever forget. So this was the simplest way to remember the contents of greater sciatic foramen, lesser sciatic foramen. We have discussed some high yield points and some difficult SBA. This is a hard level SBA in which they ask about the contents of lesser sciatic foramen, which exactly leaves the lesser sciatic foramen. Okay, and now you will understand the significance of okay. Okay. Again, the greater sciatic foramen I was talking about, it is divided by the piriformis muscle into suprapiriform and infrapiriform foramen. The contents of suprapiriform foramen is superior gluteal artery, superior gluteal nerve, that's it. Infrapiriform foramen have sciatic nerve. Again, let me show you sciatic nerve. It is very obvious, it is passing below the piriformis muscle through infrapiriform foramen. And it is the content of inguinal greater sciatic foramen. Then we have pudendal nerve in inferior gluteal artery, inferior gluteal nerve, posterior femoral cutaneous nerve of thigh, nerve to obturator internus, nerve to quadratus femoris. Then on the other hand, we have lesser sciatic foramen. We have internal pudendal artery and vein, pudendal nerve, then obturator internus tendon, and nerve to obturator internus. So this was all about the piriformis muscle and the greater and lesser sciatic foramen. Okay, let me recap. I want to check your understanding. Please tell me the attachments of piriformis muscle. Please drop in the chat box, or you can open up your mic and tell me the 3 keywords I have told you. Any volunteer? Yes, Faiva, that's excellent. What was the second keyword? Yes, perfect. Greater trochanter. We have two trochanters, greater and lesser trochanter of femur. Yes, perfect. Okay, let's move on to our next SPA. There you go. And this diagram of the female perineal region, which structure is labeled with C? Okay, your time's up. Yes, B is the right answer. That's excellent. This is perineal body. And here you can see this is levator ani muscle, which is the major muscle of the pelvic floor. Then we have superficial transverse perineal muscle, bulbosphingeus muscle, and ischioquernosus muscle. And why the perineum is very important, why we need to know the muscles of the pelvic floor, and why we need to remember the muscles of the perineum. Because these muscles we would cut during episiotomy, during spontaneous vaginal delivery. If we need to give episiotomy, which is usually given at mediolateral location, some of these muscles would be cut. So in the exam, they might you ask this question that what are the muscles which have been cut during episiotomy, specifically mediolateral episiotomy.
I think the bulbosphingeus muscle answer is superficial transverse.
Yes, yes, that's correct. Excellent. You seems like well prepared for the exam. Okay, so perineal body. What is perineal body? Those who know that, well done. Those who do not have any idea, let me tell you. Basically, perineal body is an irregular fibromuscular mass, as you can see here in the diagram. It is located at the junction of urogenital and anal triangle in the central point of perineum. So very basic regarding perineum, the structure of the perineum or the anatomy of the perineum. What happens, the perineum is divided into two areas. It is a diamond-shaped cavity. Anteriorly, we have urogenital triangle, as you can see here. Why we call this urogenital triangle? First thing, it looks like triangle. And why urogenital? Because it consists of genital organs and urethra. The posterior one or the dorsal one is known as anal triangle. And why it is known as anal triangle? Because it holds the anal canal and rectum. That's it. This is a very simplified version of the perineum. This is an overview. And here you can see between the junction of urogenital and anal triangle, we have perineal body, which is a fibromuscular mass. Why nature has designed the fibromuscular mass at this very location? Because it acts as attachment for muscle fibers from the pelvic floor and the perineum itself. Okay, for your exam, you need to know then at least don't go in a very detail of the origin and insertion and blood supply or innervation or functions of these muscles. But yes, you need to have an idea what are the muscles which are going to attach on the perineal body. So the first muscle you need to keep in your mind is the levator ani, bulbospongeus, superficial and deep transverse perineal muscle, external anal sphincter muscle, and external urethral sphincter muscle fiber. So remember the name of these muscles. These are the muscles which are going to attach on the perineal body. And what is the function of perineal body? In the woman, it acts as a tear-resistant body between the vagina and the external anal sphincter, supporting the posterior part of the vaginal wall against prolapse. And during delivery, this is the point where we usually provide the perineal support. In the male, it lies between the bulb of penis and the anus. So this is perineal body. And this is the high yield point. You need to remember the name of the muscles which are going to attach on the perineal body. So we are done with the SBAs from the identification of anatomy structures. One thing I want to second Dr. Sadia. There are many questions I was seeing. Many of the students, they are trying to book the July exam and they are worried when is the right time to start the exam preparation, and is there are they able to choose the January attempt and everything. So one thing for anyone, either you are going to book January exam or July exam 2025, the sooner you start, the better. If you are planning to take the exam in July, the sooner you start preparing, again, it is better for you. Why it is important to start your preparation now? Because competition is increasing day by day. So now is the right time to begin your preparation. One thing, you can enroll in our premium course at any time to ensure you are well prepared for the exam and to make sure, because this exam is very expensive, you are not spending your finances on this exam, but yes, you are spending your precious time. So please, again, make sure you are well prepared for the exam, and there is no right time to start the preparation. The day you have decided to give the exam, that is the exact day you need to start studying for the exam. And again, as Dr. Sadia mentioned, we are starting our third batch for MRCG Part 1 on September 20th on the basis of students' requests and inquiries. So if you are interested in enrolling, you are more than welcome to join us. Another thing, there were many questions regarding recalls. So it is worth mentioning, we are offering recalls in 3 formats. Please listen carefully. We are offering recalls in subject-wise manner, one thing. Then we offer recalls in year-wise, which is available in the PDF format. And then we have, again, the year-wise recall in a pool format. So what is pool format? That format allows you to solve questions in the same manner as you will do on the exam day. So again, if you follow the sequence for your exam preparation, first thing, you are referring to the theory, you are trying to build up your basic concepts, you are recalling your prior knowledge. For instance, if you are starting anatomy, so yes, you are done with the theory, and now what you can do, you can start subject-wise recalls along with that theory, because ultimately in the exam, the mainly questions comes from the recalls, or at least the topics which have been previously asked in the exam. All they do, they just simply twist around the information. So yes, you are done with the theory, then you do solve the subject-wise recalls. Then once you are done with all modules, by solving subject-wise recalls, you can refer to the year-wise recalls which are available in the PDF form. So this would be your second revision. And once you are done with that, this is a very good opportunity. You can solve those same year-wise recalls in the pool format, and that allows you to assess yourself, like where do you stand in your exam preparation, and it will give you, it will help to build your reflexes, and definitely it would help to manage your time skills while solving exam. I hope I'm making sense to everyone. And one more thing which is left, our short course, which is our Power Hour course. If you are only interested in this course, we are offering this for all the webinar attendees, that it is on the 50% off. You will get enrolled by paying only $130 till next 24 hours. So don't miss out on this opportunity. And if you want to contact our technical support team, these are the numbers, these are the links. You can reach out us on the Facebook page or on the email address or on the WhatsApp. So any questions so far?
Ma'am, some people says that there is a pattern, there's some changes in the pattern. It is true?
Okay, that's a very concerning question. Okay, there was, yes, RCOG has updated their curriculum. They usually do this after every 5 years. I did a live session on the updated MRCOG-1 curriculum. Basically, they updated the curriculum for the trainees who are actually working in the NHS at the moment. So in that, curriculum, they have made some changes regarding the clinical expertise and the level of experience and the level of knowledge expectations from the trainees which are working in the NHS. However, the knowledge requirement areas regarding MRCOG-1 exam curriculum, that remains the same.
Thank you.
No worries. Okay, so thank you so much for being with me so far. It was a good session. I had a lovely audience today.